Do you feel like your legs aren't as strong as they used to be? Weakness in your legs can make everyday activities like getting up from a chair, walking, and climbing stairs more difficult. Today, I'm going to show you simple but effective exercises that you can do right along with me. Hi, I'm Kathy. I'm a physical therapist. So today we're going to start with marching because this strengthens up the muscles in the front of the legs. So I'm just lifting up, alternating left and right. For these exercises today, we're going to do about 10 of each. Now, if you're following along at home, you could do between 2 and 3 sets to complete your routine. As you're lifting up your legs, you may feel the muscles in the front start to work. And if they get a little fatigued, that's exactly what we're looking for. We want to put just a little bit of stress on the muscles so that they get stronger over time. When you're doing this, another tip that I like to do is I like to have my patients lift up their toes, and that'll help keep you from dragging your toes when you're walking. The next exercise we're going to do is heel raise. This strengthens up the calf muscles. The calf muscles are important because as you're walking, they help push you off. They also act as like a brake if you lose your balance. So if you lose your balance forward, the muscles in the back of your legs act like a brake to keep you from falling forward. When you're doing these, you might feel a little burning in the calf. That's perfectly normal. If you want, when you've done your first set of 10, what you can do is a little bit of a calf stretch. And that would look something like this. You'll put one leg in front, the leg that's behind, we want to press the heel into the floor. And I'm just using my chair for a little bit of support, and you can too. I've got my front knee bent just a little bit, and the more I bend the knee in the front, the more I feel the stretch in my calf muscle. For these, you'll want to hold them about 30 seconds, and we're just going to switch over to the other side. Now, if you want, you could always do your stretches at the end of your exercise session. But today I'm just going to go ahead and do this because my calf muscles have been a little tight lately myself. So I'm just going to go ahead and do a short stretch here. The next exercise I'm going to do is a sit to stand. So what you want to do is get a sturdy chair. And if you need arm support, you can use your arms either on your thigh, or if your chair has an armrest, or even on a chair like this, you can just push right up from the chair and come back down. Now you can have your feet about hip distance apart, and you'll want to sit down with good control. When you're sitting down, that eccentric control is what really gives you that extra strengthening. So that's what we want to focus on. Now, if you can put your hands together in front of you, and that'll just make it a little bit harder than if you're pushing up from your legs. With these, you'll hinge forward from the hips as you're coming up. You don't want to bend over. You just want to hinge forward, push through the heels to stand right up. Now at the top, you don't want to lock your knees out. You just want to keep your knees soft as you're going up and down. And this exercise will help you over time to be able to get out of a chair just a little bit easier. If you find this type of content helpful, please like and subscribe. Now, since I'm already sitting in the chair, the next one I'm going to do is my knee extensions. As I'm sitting here, I just straighten out my knee as much as I can, hold it for just a few seconds, and come on back down. These also strengthen the muscles in the front of the leg, which is important for standing up and for walking. And for these, we're just going to do one side at a time. You could alternate if you wanted to, but I think when you do one side at a time, it helps to fatigue the muscle just a little bit more. So just a few more on this side, and then we'll switch over to the left. Alrighty. So now I'm switching over to this side. So when you're doing your knee extensions, you might feel a little popping or cracking in your knee, and that's called crepitus. That's an early sign of arthritis, and depending on how severe it is, you might want to just be a little bit cautious when you're doing these. If it causes you a lot of pain to extend all the way, just go the distance that you can without having a lot of pain. I have a little bit of crepitus myself, but it doesn't cause me any pain, so I just go ahead and extend nice and firmly getting that quad in the top of my leg to contract. So the next exercise we're going to do is hip abduction in standing. I've got my chair for a little bit of support, and I'm just keeping a small bend in my stance leg. Now, hip abduction targets the gluteus medius. It's one of my favorite muscles, and it's very important to keep it strong because it helps keep your pelvis level when you're walking. Now, as I'm doing this, you'll notice me looking down because I just want to make sure that my toe keeps pointing forward. When you turn your leg out, it targets a slightly different muscle. And since we want to get the gluteus medius targeted, we're just going to make sure that our toes stay pointing forward. Now, in order for me to do the left side, I'm just going to turn to the side here. And again, I'm keeping my toes pointed forward, a slight bend in my stance leg, and I'm going down with a good amount of control. I don't want to go too high because if I go too high, what's going to happen is either I'm going to lean my body one way or lean it the other way, and that could lead to back problems. So I'm engaging my core muscles so that I keep my back straight and I just gently bring my leg out to the side. Now, if you're doing these at home, you could face a counter, put both hands on the counter, do one side, do the other side, and that would be perfect. Now the next exercise is hip extension. I'm going to hold the back of my chair for a little bit of support while I keep a bend in the leg that I'm standing on and extend my hip back. Again, I've got my core muscles engaged so that I keep my back straight and so that I feel this muscle working right in the back of the leg. So we're just going to go back like this. And the nice thing about the exercises that we're doing today is it doesn't really require any special equipment. If you don't have a sturdy chair, you could maybe use a sofa. Just don't use a rocking chair or a stool with wheels because that can be a little unstable. And whatever you're getting up from, you just want to make sure that it's something that's stable. So I'm going to switch over and do my left leg now. I've got the slight bend in my stance leg. I've got my core muscles engaged. I'm holding the chair for a little bit of support, and we're just going to extend back, just like this. Now, if you don't have a sturdy chair, hopefully you'll have a countertop or someplace sturdy that you could hold on to. And if you don't have a sturdy chair, instead of doing the sit to stand, you could do mini squat. Holding a counter, we're just going to go down a little ways, keeping our bottom back so that our knees stay behind our toes and we come up. Also with this, you want to try to keep your back straight as much as you can and come back up. And this does very similar to the sit to stands, but if you don't have a sturdy chair, no worries, you can just do the mini squats. So the next exercise is stepping up and stepping down. I've got a small step stool here that's about 8 inches high, and I've got my countertop nearby. I've got my chair right in front. If you wanted to, you could put your chair on the opposite side so that you could hold on a little bit easier with both hands. And you just want to step up and down about 5 times on each leg. So now I'm switching over to my right. I'm trying to make sure that I keep my posture. And if I need to draw my belly button to my spine to make sure that I engage my core muscles, that's exactly what I'm going to do. And if I felt a little unsteady, I would just reach for the chair in front of me just to give me a little touch point to help keep me stable. Now I've got one bonus exercise for you today, and this one is for your balance. Since I already have the stool here, we're gonna go ahead and we're gonna tap, alternating left and right. Now this also works the muscles in the front of the leg, but mostly what I'm looking for with this is just a little bit of a balance component. So as we tap left and right, we're shifting our weight from one foot to the other, and I'm not completely putting my weight all the way on my foot as I'm tapping. It's just a tap and transfer the weight to the other foot. This is great if you've got a little bit of a challenge with your balance. You would still want to be close to the counter because that's going to help keep you safe. And again, with these, you'll do about 10 on each side. So the exercises we've done today, they've targeted all the major muscle groups, and that's going to help keep us strong over time. If you need more balance exercises, be sure to check this video here.